let's discuss about the causes of dysphagia. Now we can classify the causes of dysphagia as oropharyngeal causes and esophageal causes. So let's discuss about the oropharyngeal causes first. According to the symptoms of dysphagia, we can tell what might be the cause of the dysphagia. So I'm going to tell all the symptoms that can be associated with dysphagia and accordingly the cause which might be responsible for dysphagia. Now, if the patient presents with difficulty in initiating swallowing, if the patient cannot initiate swallowing, then the cause might be functional dysphagia. It can be cranial nerve 11 lesion. It can be motor neuron disease. These are the differentials if the patient is unable to initiate swallowing. If the patient is having coughing, choking, or nasal regurgitation, the lesion might be due to upper motor neuron lesion. There may be associated bilateral hemiplegia, due to which there might be dysphagia because of involvement of upper motor neuron. There might be multiple sclerosis. So these are the differentials if the patient is coughing, choking, or having nasal regurgitation. If the patient presents with lump in the throat, the cause might be pharyngeal pouch or thyroid problems or post cricoid problems, or it might be psychosomatic, or we know this condition as globus hystericus pharyngeus. Now let's come to the esophageal causes. Now if the symptom is there is dysphagia while having liquids or solids, then the cause might be motor dysfunction like achalasia cardia, esophageal spasm, or systemic sclerosis. If the patient feels like the food has been stuck in the chest during swallowing, or if the symptom is worse with solids, then the cause might be due to mechanical block of esophagus due to any foreign body in the lumen of the esophagus. In the wall of esophagus, there might be some pathology like stricture of esophagus, carcinoma esophagus, Plummer-Vinson syndrome. These are the causes which can cause mechanical blockage of the esophagus. And there might be some other causes outside the esophagus which can also cause mechanical blockage, like if there is aneurysm present which can compress the esophagus from outside causing dysphagia, if there is any neoplasm, any tumor, any growth which can compress the esophagus again from the outside causing mechanical block which may lead to dysphagia. Now there is an entity which is known as dysphagia lusoria, that is due to an aberrant right subclavian artery which compresses over the esophagus from its back. From the posterior aspect, this artery, aberrant artery, it causes compression of the esophagus causing dysphagia. This is known as dysphagia lusoria. If the patient is having chest pain while swallowing with dysphagia, this may be due to esophagitis or esophageal spasm, even may be due to achalasia cardia. Some other causes of dysphagia include Alzheimer's disease, brain tumor, then Guillain-Barré syndrome, Huntington's disease, then poliomyelitis, then dermatomyositis, muscular dystrophies, cerebral palsy, Parkinsonism, stroke, CNS infections, and polymyositis. So these are some random causes which can lead to dysphagia. Thank you for watching.